Hello everyone. Today I'm going to speak about the topic dysphagia. In this presentation, we will discuss about what is dysphagia, how it affects in older adults, what is dysphagia in adult myopathies, and how it affects emotionally and psychologically. So basically, what dysphagia is, it is a medical term used to define swallowing disorders. A person feels less willingness to eat, and when they eat they feel sometimes coughing and choking, right? So what happens, their food comes through back through the nose also, and sometimes due to muscle weakness they also get a less chewability. So if we discuss about the dysphagia in older adults, it affects up to 10% to 33% of older adults all around the world. Most common adults are affected who have experienced strokes or neurodegenerative diseases like Parkinson or Alzheimer diseases. So if we say what is this relation between aging and swallowing, it is like dysphagia. This is the term used to define the changes in the structure and innervation of swallowing disorders. What it means that when a person loses structure of the jaw or something like in the bones in the neck, or any muscles weakens and they get a swallowing disorders, so that is called as the presbyopia, and this results in the less speed of movement, less generation of pressure and more, right? So according to the research, it also decreases the sense of smell or taste in the older adults. So there are a few methods by which we can detect the dysphagia in the older adults. Some of them are physical examination, like if you find a person who is coughing and choking while eating, and they feel like they are about to vomit, or they feel like they don't like to eat because it pains when they eat. So that these are the symptoms, like these are the physical examination if you want to see a person that he or she is suffering from dysphagia or not. And there are some screening tests also that are done to check, like if a person is suffering from dysphagia or not. These are like gugging swallowing screen or massive bedside swallowing screen. These are not commonly used, but these are used in the highly precise cases. So now next we are here going to discuss. So now we are continuing discussing about the adult myopathies. What happens in the older people when they get older, their muscle weakens, and due to the muscle weakness there happens a dysfunction of muscle fibers. Due to that they get a less chewability, jaw problems and like that, and due to that they get many side effects and they become a patient of dysphagia. So how we can get to know that a person is suffering from dysphagia in myopathy? So some symptoms are slow eating, difficulty in chewing food, excessive siluria, oronasal regurgitation, recurrent aspiration, and aspiration pneumonia. So, how we can assess dysphagia in the patients? So, there are a few methods to assess the dysphagia. These are neuromuscular disease swallowing status scale, Sydney Swallow questionnaire, and swallowing quality of the life. These are the few methods by which we can assess the dysphagia. So here are the special conditions in myopathy dysphagia. First is oculopharyngeal muscular dystrophy, OPMD. It is a prototype adult onset hereditary myopathy that dysphagia has a major symptoms. It means that who have myopathy in their hereditary, they get in the adult age, and they get dysphagia as their major symptom, because if a person has weakened muscle from since the childhood, they will definitely have weak muscles and they will suffer from dysphagia. Another is oculopharyngeal distal myopathy, OPDM. Earlier it was considered that it is different from OPMD, but but because in the Japanese, some of the patients show the same symptoms as shown in the OPMD, but later on it was diagnosed that it is totally different from the another one. Next is scapulohumeral dystrophy, FSHD. So it is a condition where the facial weakness occurs. So from the facial weakness, we can imagine that it's the weakness of the jawline, the lips, or the cheeks, something around our face. So it means that it weakens the movement and our muscles of the face, and then we get a swelling problem. So this is the condition when they get the swelling problem, they suffer from dysphagia. And next here we are going to discuss about the emotional and psychological effects of dysphagia. As I told you earlier that dysphagia has many side effects on a patient's health, not like the physically, mentally, emotionally, every type of effects it gives. So now we are going to discuss about the emotional and psychological effects of the dysphagia. The person who suffers from dysphagia, they suffer from various problems like anger, anxiety, sadness. This ultimately ruins their relationship with their near ones, or like even if a healthcare worker is working to take care of for them, they also ruin their relationship with them. So, to check about the extent of the relation between dysphagia and the emotional psychological effect, a study was done, right? But basically, I believe we can normally recognize that if we personally take it on ourselves, if we are not able to eat when we have sore throat or something, we usually get irritated. And imagine about a person who is suffering from this problem every day, they will definitely be upset, angry, sad. These are the common symptoms that every dysphagia person has to feel. This is not like they are doing like mandatory, like for deliberately. It's like that their problem is forcing them to do so. So, in this study, like this study or assessment was done, this assessment is known as GDEFA, Judendrag Dysphagia Emotion and Family Assessment. In this assessment, around 160 participants were chosen, and out of them, 49 were health workers, patients, and family members participated in that. This assessment was done by a questionnaire based on the link between the dysphagia and the emotions. Like questionnaires were created that can ultimately detect the extent of dysphagia on their emotions, on a person's emotion, right? So in this assessment, what results were found that those who were patients, they were more sad and angry as compared to healthcare workers in case of dysphagia. Obviously, a person who is suffering from dysphagia, they will be more sad, but a person who is already a health worker and who is suffering from dysphagia, they have like some knowledge about this disease and they know how to calm themselves. So that's why they patients were found more sad or angry as compared to the healthcare workers who were also suffering from dysphagia. And and if we speak about a person who lives in a family and still have a dysphagia, sometimes they are not admitted in hospital or like that, they are not living alone, they are living with family, and they also have a problem dysphagia. In that case, it's not the sadness or anger, it's the anxiety is like that every person other is normal, but they are not able to do like the normal things like person who doesn't have dysphagia are doing, like they are properly eating, they are properly talking, they have no jaw problems, no swallowing movement, no swallowing problem. So they felt anxious about their conditions. They were not sad or angry, they were depressed, they were anxious about their condition. And in that study, some of the patients recommended that they feared for the choking, like what if they choke something while eating or something like that. But according the experts, like who have great knowledge of dysphagia, they realized that it was not their fear for the choking. It was a fear that what if they make mistakes. Like they were like that, what if they spill food while they are eating because of their dysphagia problem, because that they can't eat? What if they vomit back? What others will think? It was their main concern. The patients were fear of not the choking, but they were fear for making the mistakes. And this the conclusion was that this this tool, like this assessment, is still valid. It is used in many cases, and it is the best method to diagnose the relationship between the emotional psychological changes and the swallowing disorders or the dysphagia. And it is a basically a simple method. You just have to question a person, you have to get their answer, and the psychological person can judgment, a psychological doctor can judge that if person is suffering from which condition, which stage, and what's happening with that. It's not a normal problem. Like it's not easy to tolerate, because when you are not getting something properly to eat, you are not able to eat, you are not able to speak, you are not able to swallow, it's difficult for everyone, right? So hope that you guys take care for yourself, do facial exercises, keep your jaw strong, try to do some exercises, try to do like movement of neck, do some exercises so that you can feel strong enough. And last but not the least, prepare your mindset. If you have a great mindset, you can cure any disease. So this is all about dysphagia. I hope you guys liked it. This was prepared by me, my like Anmol, and Inderpreet Kaur Rupal. We both are student of food and nutrition management. We have provided link below about the articles, the from where we use our information. If you guys need more information regarding the things, you can scroll down and click on the links and go to the website and search. Thank you. I hope you guys liked it.